Thank you to Pathlibrary for this case, and we're gonna do this approach where I go about this case blindly, so there's a chance I might get this wrong, so don't hold it against me. But what we have is a duodenum. So I'm not gonna even look at the history for now. Right now, I'm just gonna look at this is indeed duodenum, because there's Brunner glands in the submucosa, and this I'm immediately suspecting celiacs because it looks like colon, right? There's no these villiform villi. They're not elongated. They're blunted. Some other things that we look for celiacs is intraepithelial lymphocytes, and that especially happens during the acute phase of celiacs, and so it might have already occurred. But maybe these are some lymphocytes, or maybe that's a tangential. But I could buy that these are lymphocytes. We can also see some newts in the intraepithelium, especially if it's acute process. But we do see some intraepithelial lymphocytes. Celiacs, I definitely want the information. I want to clinically correlate with it. I want that tissue transglutaminase IgA level. Or if that's negative, there can be a chance of false negatives if this patient is IgA deficient. Then in that case, you want to do IgG, tissue transglutaminase levels. Also, some things that we should reflexively look for are plasma cells, so this patient doesn't have CBID, as well as Giardia. But I have a good hunch that this is celiacs. So 15-year-old female with diarrhea, they probably have iron deficiency or is on the way. The diagnosis is celiacs, and these intraepithelial. Oh wow, this is a great field for intraepithelial lymphocytes. So if you're not sure what I mean by these, you see these little dot-like cells right here that have high NC ratios but are small. These are the lymphocytes. You shouldn't have that in normal duodenum. So this person is not going to be able to eat gluten. They're not going to be able to absorb nutrients as well, including like iron. They might have fat malabsorption, not being able to absorb vitamin K, A, D, E. They're going to have growth stunting if they don't get this treated. And so let's look at a practice question. What is the equivalent threshold in the jejunum and ileum? At least 30 intraepithelial per 100 enterocytes. I'm not sure about this. 40 intraepithelial lymphocytes. Name at least one non-neoplastic disease and one neoplastic disease associated with celiacs. Celiacs, it's associated with this neoplastic called, I think it's called Meadle. I forget what it was called. It stood for, but it's like something enterocytic intestinal T-cell lymphoma, and non-neoplastic disease, iron deficiency anemia. Oh, dermatitis herpetiformis, yeah, that's a good one. It's a classic cutaneous association, and if you do microscopy with fluoroscope, you'll see IgA mediated, and it'll be granular in the dermal papillae for IgA. And then, not Meadle, but Edel, enteropathy associated T-cell lymphoma. There is a Meadle, but that one is not associated with celiacs. That one is CD56 positive. A patient with a history of CBID is suspected to have celiac disease. A duodenal biopsy shows mildly increased IELs, absent lamina-appropriate plasma cells, and preserved villus architecture. What test will definitively establish the diagnosis of celiacs? So you want to get your tissue transglutaminase. It is associated with HLA DQ2, DQ8 variants. And so, this is talking about how the diagnosis is multifactorial. Pathologies, with serology as well as clinic symptoms. And so, all right. Well, I'll see you all next time. This was a good case of celiac disease.